Okay, ladies and gentlemen, let's get started. I need to know from everybody, what is your favorite medical drama? Your favorite doctor's show? You know, ER, Good Doctor, what? Wait, what is it again? What if you haven't watched any? Oh, just listen up, no problem. Okay, what is Grey's Anatomy? ER? Grey's Anatomy?
911.
What, go ahead.
911.
Oh, 911, okay. I like The Good Doctor. Medical dramas are great. I love a Good Doctor show, but the problem with with some of this is if you do a doctor's, in the doctor's show, they do give you a little bit of a taste of what it's like in medicine, but it's Hollywood, so that's not always accurate, okay? So what we're here in the Doctors Club, though, future doctors, we are going to have the accurate information. That's what we're going to have. So let's start and let's make sure we know the path to medical school. Many of you may already have a good idea, but let's make sure we're clear on the path. So the path is, and by the way, a path is just a path. There's lots of variations and shortcuts, and not everybody has the same one. The other Dr. Webb and I have completely different paths to becoming physicians, completely different. But let me just give you the general view, make sure we're all on the same page. First of all, obviously, high school. You're going to finish and get a high school degree. No problem. Second, you're going to matriculate into college, and you're going to get a bachelor's degree at an accredited college, right? A bachelor's at an accredited college. Now, your last 2 years of college, or last 2 years of college, if you're going the traditional route, what are you doing?
Studying for the MCAT?
Yes, studying for the MCAT. Everybody know what the MCAT is? The medical, everybody, somebody, who said yes? Someone said yes? Okay, medical college admissions test. And think SAT for medical school, right? It is the test to make sure that you are prepared and know enough science to do well in medical school. All right, that's what you're going to be doing that last year. And you're also going to be looking to see what medical schools you're interested in, and you're going to be doing your applications. It's very much like college in that you're going to have a personal essay, you're going to be getting recommendations, you got that standardized test, you're going to be looking at all the zillions of med schools around, and then you're going to matriculate into the med school of your choice because you're going to be so prepared. At least this group is, okay? Now, the second thing that's going to, then after college, let's say you do the traditional route and you do 4 years of college. After that 4 years of college, the last couple years of college, what are you going to be doing? What did you say? Well, I'm sorry, yeah. I'm sorry, I said the first 4 years of college. After you've finished and you've gotten to the med school of your choice, you're going to be, the last 2 years of the last 2 years of medical school, what are you going to be doing?
Residency. You'll be doing your residency.
Residency. Okay, so you've got high school, you've got 4 years of college. Last couple years of college, you're going to be studying for the MCAT and doing your application. You get into the med school of your choice. You get into the med school of your choice. The last 2 years, as Caden said, you'll be doing your residency. Now, everybody, the residency and internship, your internship is, everybody know the difference? Anybody know the difference between internship and residency? No? Okay. Oh.
Internship like the last few years of medical school?
Actually, no. Actually, you're close, though. You're close. It's very close. It's the first year after medical school. So when we think of residency, the very first year of residency is internship. And during your internship, you're going to, everybody has an internship. and then everybody goes on to residency. Now, during that time of residency and internship, you're all going to split off. During medical school, oh, you had a question? No. Everybody, that's a good question. Starting in internship and residency, okay. Oh, I'm sorry. She asked, is the difference between residency and internship that you don't get paid? No, that's not it. Starting after you get your MD degree, you start getting paid in your internship now, and residency. Now, you're not going to get paid a lot. Okay? Hopefully you'll get enough to cover student loans. But you will get paid because you will have an MD at that point. Let me be real clear. During residency, the very first year of internship, it's just called internship, that first year. The years after that are residencies. And they can be anywhere between 3 years, your residency can be anywhere from 3 years to 7 years, depending on your specialty. So I did psychiatry residency is 4 years. Anesthesia residency, 4 years. Our special guest, the orthopedic surgeon and the OB-GYN, will tell you how long theirs took. But those are anywhere from 3 to 7 years. Then after that, you can practice. You take one more board exam, and you can go practice. But you may decide you want to subspecialize. So I see adults. In adult I see adults only, but if I wanted to see kiddos, I would need to do some additional years, and that's called a fellowship. All right, so let's go back and summarize. College, let's say you do 4 years of college, but at bottom line, you get a bachelor's degree. Every MD goes to 4 years of medical school. Every MD. We all do the same thing, no matter what specialty. After medical school, you go on to residency to do a year of internship and then years of residency. And that can be anywhere from 3 to 7 years. And then after residency, you may go on and practice, or you may go on and do a fellowship for another 1 to 3 years. That sound like a lot of years? A lot of school? She said, it sounds like we'll be in the late 20s, early 30s by the time we get out, and you are absolutely right. And so, if you're thinking to yourself, God, that's a whole lot of school, I want you to ask yourself, in 12 years, after you finish that, when you're in your early 30s or late 20s, you'll either have an MD or you won't. You'll either be practicing medicine or you won't. Either way, you'll still be 30-ish. And you get to choose what your profession will be, okay? Now, it's also, as we said, a lot of standardized tests, right? There's boards there's the MCAT to get you into medical school. There's the after medical school, there's your board exams, step 1, step 2, step 3. They keep changing many of those. But there's board exams to get into residency. And after residency, you got to do another board to be board certified in your specialty. It's a lot of standardized tests. Okay, that's all right. You guys are getting started now. You will be ready. That's where that confidence comes in, and we're going to get good at it. So now the next thing. The other thing about, so that's the path to medical school, the traditional one. Now let's talk then about, that's the path to becoming a doctor. Now let's talk about the path to getting into medical school. There's a bunch of myths and misconceptions about that going around. So let me just ask you a question. Let's see. Let's get a consensus of the room. Let's see, let me pick a card, any card. All right, here's an easy one. You should not, if you volunteering in a non-medical field, does not help your application to get into med school. True or false? We've got a false, false, false. Any truths? Okay, a non-medical volunteering period is helpful. Now you want to go ahead and definitely volunteer and do community service in a medically related field, but let's say your thing is dance, or your thing is band, or your thing is gymnastics. I was on the medical school admissions committee way back when I first started my career, and we looked to see if people were passionate about a field, and if they had persistence, and if they showed that they really were excited and achieving in that field. So go ahead and do that. Now you're going to need to do some definitely health-related volunteering, but both are important. Another question. Here's another question. Is this true or false? People who major in a non-science do not have as strong a chance of getting in med school. Wait, we got some. Who says true? Who says false? Okay, all right. Here's the deal. You can get into medical school whether you major in a science or you major in a non-science. The key is if you take the required courses. You've got to have the prerequisites, and you've got to be able to demonstrate that you can handle the sciences and critical thinking. So prerequisites, everybody know what those are? I'll run them down. Physics and lab. These are college courses that you've got to have. Physics and lab. Biology plus lab. Chemistry plus lab. Organic chemistry plus lab. Biochemistry. Calculus and English. Most medical schools require those at the minimum. Now, again, I can't emphasize this enough. The medical school you choose to go to, check those prerequisites because they're not always going to be the same. But those are the courses that you need to have. And if you major in a non-science, great. Just make sure you've got your science courses covered. All right? And you may, if you major in something else, need to show some things that demonstrate that you really are serious about medicine, that you're going to want to really excel in those things. Okay, question number 3. This is an interesting one. Most students, let's see, how shall I put this? Most students do not work during medical school. Medical school is expensive, just like college is. Most students do not work during medical school. True or false? How many falses? How many trues? Okay. The truth of the matter is most students do not work during medical school. You know why? Yeah, it's too doggone hard. It is hard as I don't know what. There's just no time. So what you want to do is for medical school, this is why you guys are at a real advantage in the Zero Debt College Project, because you won't have those undergraduate student loans. And we will be working with you there's not as many scholarships available for medical school. It'd be pretty unlikely a medical school is going to offer you a scholarship, but we're going to do your darndest so you won't have any undergraduate loans, and we're going to get anything that's out there. You guys are sitting pretty right now. Okay. Let's see, what's another question? Oh yeah, most students who get into medical school have a 4.0 GPA in college. Got a false? False? False. Okay. That is correct. False is correct. Most students do not have a 4.0. Now, what you do know, in fact, I was just looking the statistics up. The average GPA last year for students getting into medical school was, I want to tell you it was 3.59. Okay? Now, having said that, obviously the average was not a 4.0, but having said that, the higher your GPA, the better your chances. Higher GPA, better chances, remember that. If your GPA is not strong, you're gonna make sure that you strengthen in other areas, but some schools, especially the top tier medical schools, won't even look at you if your college GPA is not top notch. So what you wanna do is just improve your chances, okay? Next thing is, let's see. How about this one? Many medical schools require you to have a psychological evaluation to see if you're fit for medical school. You got a true, we got a true, we've got a false. Okay, this is a tricky one. The answer is false. There is something called the Casper that you've probably heard about, or the Duet. These are tests that are given out for medical school. They weren't around when I went through, but they're around now. And what they do is they test things like ethics, your self-awareness, communication skill, collaboration, all right? Those are the things they test. Not all medical schools require them. I looked it up, and San Antonio does, I believe UT Southwestern does, just for an example. But not all of them do. It is different, though, from a psychological evaluation. They are not testing to see if you have a psychiatric or psychological illness. They are just checking to see these other pieces, okay? Last question. You need to pass a criminal records check before you can be a doctor or get into some medical schools. True or false? True? True? Any false? The answer is true. The reason is, to get a medical license, you can't have a felony on your record. Now, but I don't want you guys to be nervous. The schools vary, and it is up to each individual school what they allow. But they expect you, especially regarding things like giving medication to patient, prescribing, whether or not you have a record in terms of abuse, abuse of others. These things we need to make sure that you don't have, and therefore they do a criminal records check. Bottom line, when you go to college, keep your nose clean, okay? There's gonna be some parties and stuff, people are gonna be doing some ratchet things, do it, just be on the up and up. Okay, last piece, and I saw our special guest arrive too. The last piece is this. Everybody, you just heard the path to medical school. We talked about the requirements that you need to have for medical school. And the third thing is what you can do now. Right now, in high school, some of you starting college, what can you do now to improve your chances? All right, so here's what we're gonna do. What you wanna do is all those courses we said that are prerequisites, you wanna take as many topics in those areas as you can right now. If your high school offers biology, calculus, chemistry, physics, take them. If your high school doesn't offer them, take something online, do the community college, get familiar before you matriculate into college. Here's why. You don't want your first college calculus course to hit you and you've never seen calculus before. You just don't want to happen. You want to know, you want to be at least familiar with it. If you're already a senior and you haven't had that yet, no problem. See if you can look online and get some information, see what you can do before you take those. Second thing, pay attention to your English courses. It's really, from here on out, you'll be doing personal statements, essays, presenting yourself in writing. You're going to want to do that and be able to read and write quickly. As Dr. Thompson said, you're going to want to get that done. Third thing, and this is one dear to my heart. For years, what I did in the beginning of my career, maybe the first 10 years, was I worked with medical students trying to help them get through medical school. The number one thing I saw made them not make it was not how smart they are. By the time you get there, they let you in, you're smart enough. It is confidence, anxiety about, test anxiety, I can't do it, someone saying something to you and you believing them. Your goal now, get to know yourself, know what your strengths are, know where your growth edges are, know where you shine. We're not all the same. Jerry, the other Dr. Webb and I are very different. You gotta know how you learn, where you need tutoring, where you don't. You gotta get that in there because that's what's gonna get you there. I'll talk more about that at another time. We'll have another workshop on getting into medical school later in the Doctors Club, but I'm telling you, I saw more people crash and burn that way than any academic there was. All right, so now we know, you've heard it, you know that, the path to medical school, you know what the requirements are to get into medical school, and you know what you can be doing now. Oh shoot, I forgot. Volunteering, absolutely volunteer. We'll have other opportunities and things to suggest, but the ones that you guys were talking about are really important as well. All right, I'm wrapping up. I think it's time for grand rounds. All right. Okay.
I just want to say the best benefit of going to medical school is I met Dr. Carmen Webb. And just a little bit about that. I met her through her dad, actually. He was my mentor at the University of Texas Medical San Antonio. And myself and my classmate was very fortunate enough to be placed at the table of Dr. Charles Thurston, who's a dermatologist, graduated AOA, #1 in his medical class at Meharry Medical College. And my classmate was Michael Archie. So we sat there. Michael Archie got the scholarship for the student who had demonstrated the most need, but I got the most beautiful medical student from UT Southwestern. So I just want to say that. And the way we met, I'll just quickly, is that Dr. Thurston, of course, is a dermatologist, and at the dinner was in August, and I get this very weird rash. If I get really nervous and stressed, and of course I did during medical school, we studied and had lots of tests, and round about May, June, I broke out and said, what was that dermatologist's name? Oh, Dr. Thurston. So in those days we had the yellow pages. Looked it up, it says Dr. Charles Thurston. But unfortunately, I called the home number. And guess who answered the phone? Carmen. And she said, this is Dr. Thurston, but you called the home number. She said, but you know what? I'll make the appointment for you. I said, oh, thank you very much. And so I thought nothing of it, showed up for my appointment. We had been up, we had just finished taking our exams, and lo and behold, first person I saw was Carmen. She was a receptionist working in Dr. Thurston's office. One of my favorite obstetrician and gynecologists, I worked with her at Presbyterian, now known as Texas Health and Gynecology. Let's give it up for Dr. Christy Walker.
Thank you, Dr. Webb.
Oh, you're very welcome.
Okay, well, I'd just like to thank both Drs. Webbs for inviting me and my husband here to speak with you. Just like you said, I'm Christy Walker. I am an OBGYN, and I practice here just right down the street. Dr. Webb and I have worked together for several years now, and it's great just being in the OR because I know as long as he's taking care of the patient, He will take care of them, their airway, their anesthesia, make sure all of their medical conditions and all of that are taken care of while I'm performing the surgery. So it's really good to have a good team of physicians and doctors taking care of you. As far as just to kind of backpedal a little bit with the Heimlich maneuver, you really do, it is really important because you will never know when you need to do it. When I was in residency, one of my attendings, and so attendings are like the physicians that kind of teach us, like we're their apprentice, how to operate. And one of the attendings who I absolutely just thought he walked on water, but I was terrified of him because everyone was, because he was so mean, and if you didn't know the answer, you couldn't really ask him a question unless you knew how to work through it and be prepared to do what they call pimp you. So if I were in the OR or something like that and I had a question, or even if I didn't know about the surgery, he would just keep asking me, and I was just like, Lord, just let me pass out or something. So anyway, we're in the clinic, and he comes in, and he's not okay. He is turning beet red, and he is choking. And all of our other residents ran out because they were terrified of him, and they knew he was choking, but they didn't want to, they were too scared of him to help him. So I just had to tell him, like, listen, you're choking, and I'm going to do the Heimlich on you, and you're going, and so anyway, I did it, and it did save him. So after that, I could do no wrong. So it was a whole different experience for me. So anyway, I want to talk to you just about the day in the life of my life as an OBGYN. My type of personality is I get bored easily. So, after I'm doing something for a little bit, then I want to do something different. I do like control. I like repetition. I like to know what's going on, but doing things differently is something that I tend to be drawn to. So women's health, or OBGYN, kind of allows you to do something different every day. As an OBGYN, my week starts off, I can do something different every day. So in residency, when we do medical school, and we do our you do the years in the classroom, and then we do our clinicals. And then in the clinicals, you get to rotate and see what all the different specialties do. And so in residency, it's kind of similar to that because we're still studying, but we do our clinicals. And each time or each day as we get our schedule, we rotate through different things. And so I designed, once I decided that I wanted to do women's health, because I like to help people, a lot of times with women, things that the issues and things that we deal with are related, not just about your pap smear or the wellness exam or birth control or just different things like that, but are some of the emotional things and all of that, they all intertwine and work together. So with that being said, as I take care of a woman, it's great because I wake up, like on a Monday, for example, or a Sunday night as I'm preparing for my week, as I go through the week, I can look at my calendar, and each day is a little bit of something different. So, for example, I like to start off my well woman exams or the annual visits or checkups at the first part of the week. So on Monday, that might be what I do most of. And I also see problems that come in for the weekend. So if someone had to go to the emergency room, if they had a problem or something like that, and they didn't get to go to an urgent care or some other type of place, then they may come and see me for their problems, and I'm able to help them. So that's kind of a typical day on a Monday for me coming in. If there's anyone that was my patient that was admitted into the hospital, then before I go to the office or at lunchtime, then I will make my rounds at the hospital. And rounds is just when you're seeing the patients that are in the hospital. On Tuesdays, Fridays are the most common days for me to schedule surgeries, or anyone that needs surgery that I have to put them in, then I will schedule them. And those are usually not set in stone, but those are the most common days that I probably work with Dr. Webb. And so I get up. Most of our surgeries start about 7 or 7:30, so I try to get to the hospital. I wake up in the morning, but depending on the time, about 5 or 5:30, I try to meditate, pray, do something to kind of help me think about what my day is and the goals and the objectives or the mission that God has placed in front of me, and just be thankful that I'm able to help someone. So anyway, then I do that. I come in to the hospital between, just depending on the time, between 6:30, 6:45, or between 6 and 6:45, depending on the time my surgery starts, to see the patient, to see their family, to make sure that everything that we need in order to perform the surgery is there, to answer any questions that they have. And then I have a day where I operate and I do different surgeries. Also, on that day, if I have patients that are are pregnant and they are it's time for them to do their due, and they have what's called the baby's not coming, or for whatever reason they need to be delivered, then those are the days that I most commonly schedule an induction or their delivery, or if they need a C-section, then I will schedule them. That's my surgery day, like surgeries in the hospital. Now, of course, the week or the day doesn't always flow exactly as such, but if I have my way or my control, that's how that day goes on a Tuesday. And so it's something different, completely different from my Monday. On Wednesdays, that's the day where I like to see most of my pregnant patients. And I like that because if I took, as far as schedule, now this does not include if they have a problem or something like that. If that's the case, I see a patient any day of the week that they need to be seen. But on a Wednesday, I like that because if I had a long weekend, if we had like a 3 or 4 day weekend, and we didn't work Friday, or if I went out of town on a Sunday or over the weekend and our flight was delayed, then their appointment's not on Monday. So it's right there smack in the middle of the week, and usually I'm always around in the middle of the week. So a Wednesday is a nice day for me to see those patients and to devote my attention to them, and look at their ultrasounds, do anything else that needs to be done, talk to their families, answer all the questions that they have. They usually have like 2 or 3 pages of questions. And so we just kind of try to go through and help them to understand what they're going through and to take care of them. Also, it kind of puts me in the mindset too of I'm not thinking about, someone with other issues, especially in women's health with maternity. You're taking care of 2 patients, so I'm thinking about mom and baby and everything. So my office, my staff, everything is devoted on that day, primarily to making sure we find reasons for this. For me, I tell the moms, I'm looking for a reason for you to stay pregnant. Like today, I make sure you meet all of your goals, your objectives, and your mission, that I can see or anticipate right now for you to be able to go home and come back and see you, and whether the appointment is later that week, the next week, or 2 weeks or a month from now in pregnancy. So that's how I practice women's health. But if they don't meet all the objectives, then I do more tests for them. We may send them to labor and delivery to be monitored and things like that. And then with women's health, especially with a pregnant woman, they don't, you hear about the boy who, the boy who called wolf or played wolf. With that, like with women's health, you don't get to do that. Like if you say your stomach hurts or whatever, each time we are going to work you up as if it's the first time. Each time is going to be just like calling a code, or a CPR. We're going to work through and do all the measures to rule everything out. So that's what my obstetric day looks like. And then on Thursdays, that's the day that I like to do procedures in the office. So those are procedures that don't require someone to be put to sleep. They may require some a sedative or conscious sedation, maybe some numbing medicine or things like that. So if they had like an abnormal pap smear, then I can do additional testing, microscopy to look at their cervix or the opening of the uterus under the microscope to see, because I'm looking for evidence of cancer. If they need other procedures done, then I do those in-office procedures on a Thursday. And then Friday, back again, I am any other mild or outpatient surgeries where they may go home on that day, then that's what I usually do on Fridays. Any other patients that need to come in at the end of the week, and then I usually get caught up with paperwork. Now, before all of these days, before my day starts, whether it's in surgery or in the office, usually sometime before seeing those patients, usually I'm rounding in the hospital. So when I have free time, then that's where I'm trying to take that time to see any other patients in the hospital. And so that's what my day usually looks like, or actually my week looks like. Any questions for me? Yes. What's your name? Denaya. What's your favorite women's health? Well, my favorite part, well, that's a great question, because I became a doctor because I wanted to help, to be able to help people. And I thought about different specialties, and the thing that got me was delivering the baby. So when I did, when we were in medical school, we got to do our clinical rotations. And on the obstetric and gynecology rotation, I came to school knowing or thinking that I wanted to be an OB-GYN, but I wasn't quite sure. When I saw the hours and when I saw how sleepy I got in the middle of the night, I was like, Jesus, let me think about something different. Like, I got to get my sleep. But when I did, I thought about radiology, I thought about psychiatry, other things, but when I delivered that baby, one of the midwives let me deliver her baby. Actually, she let me deliver a couple because she had so many. I was sold. It was just like I was riding on cloud 9, and nothing could take that away. So that's the thing that is probably my favorite thing to do, is to deliver baby. If you have those Pandora bracelets, and one of my first Pandora slides was a little carriage, because it was in a carriage and then a little happiness charm, because that's what it is. Most of the time we're delivering happiness, and so it's so amazing just to see how God just can do that, and the things and how the changes that the woman's body goes through in order to have a baby. The uterus is the size of a pear. The uterus that's where we carry our babies. It's the size of a pear, and it grows enough to and stretches enough to allow a 7 to 9 pound full-grown baby. And then the cervix, or where we have our pap smear, if you guys, once you guys kind of get through that stage, or those who have already gone through it, the cervix is like this, it's hard, like a banana, like a unripened banana, and it's just hard, but a ripe banana is soft and you can peel it away. And so for something so small, like the size of a banana, to be able to allow a baby to pass through is amazing. And so that's my favorite thing. Did I answer your question? Okay. Yes. What's your name? Allie, yes.
So my question for you is, so you said you work at a hospital, so how are you able to take the weekends off if you're on call? That's what I want to know, because my uncle's an anesthesiologist, and he'll come to our house all the time, but then he'll have to leave like 30 minutes later because the hospital calls him back or something.
Oh, yes.
So I was just wondering, how are you able to take weekends off?
Great question. We usually have. Okay, her question is, how am I able to take the weekends off if I have call? So, and to just be able to do life, right? So when you're on call, then that means you are available for the patients to the hospital or whatever. So you need to make yourself available. So when I'm on call, I just kind of it just depends on what's going on. So I start off and I round, see what's going on, make sure all the patients are taken care of. But if something, an emergency or something comes in for myself or the group of physicians, so we normally like group together and we cover for each other. So this weekend I might be on call, but you know, I'll have the next 3 to 4 weekends off. And so my partners or the people that are in the group with me can take care of those patients.
Fantastic. Oh, but thank you so much. And now we're going to have her wonderful husband also come up, Dr. Torrance Walker. He's an orthopedic surgeon. We're so happy and proud of him, and we're going to let you have a chance to listen to him, okay? Thank you, sir. All right.
Good afternoon, everyone. How you doing? All right. My name is Torrance Walker. I'm an orthopedic surgeon. And for those of you who don't know what an orthopedic surgeon is, we are doctors who take care of the musculoskeletal system. So pretty much anything from the neck down. We take care of all the bones and joints related to motion. So one of our motto is life is motion and motion is life. So we like to keep people moving. The doctors that take care of the bones and joints of the face are the ear, nose, and throat doctors, ear, nose, and throat doctors. And the doctors who take care of the cranium and the brain are the neurosurgeons. They also take care of the spine, but orthopedics and neurosurgeons kind of overlap in taking care of spinal problems. So I'm an orthopedic surgeon. I particularly practice in sports medicine and hip and knee reconstruction. So we take care of athletes, people who want to stay active, even weekend warriors or anybody, pretty much anybody. And we take care of people from birth to their way old, okay? So the doctors that take care of children are pediatric orthopedic surgeons. And they take care of people who are born with birth abnormalities and things like that and help correct those kind of things. I practice and focus on adult medicine, so anyone pretty much skeletally mature and older. So anybody that's 16, 17, 18, something like that and older. I didn't know I wanted to be an orthopedic surgeon until I got into medical school. So I didn't know anything about orthopedic surgery until really I got into medical school. Now, fortunately, my father was a dentist and my uncle is a medicine doctor, so I'm familiar with health professions. So growing up, we had exposure to health professions like this arena here, so this is a great thing for you guys to really congratulate you and thank you for putting this on. Yeah. So we were exposed to programs like this where we come in and talk to different doctors. There were medical doctors, family medicine, surgeons, general surgeons. So we were exposed to dental and pharmacy, all those type of specialties that are in health professions. But I never met an orthopedic surgeon and didn't know anything about it till I got in medical school. So that's an important thing is that you don't have to decide right now that what specialty you want to be. You can have an idea if it's based on what you're exposed to. But we did rotations in medical school and rotated through ortho. And I think we only gave you like 2 weeks, but during those 2 weeks of my rotation in ortho, I thought it was great. Thought it was a good fit for me and my strengths, the things that I like. So I pursued that. And in the 4th year of medical school, we got to do elective rotation. So I did another elective just to be sure that's what I wanted to do. So that's how I became interested in orthopedics, by just being exposed to it. So it's good to be exposed to things, but you don't have to decide now. But what you do have to decide is that you're going to be a doctor. You have to decide that. You have to say, I'm going to be a doctor. There's a whole field of different medical specialties that you can do in medicine. So you have to decide you're going to be a doctor. Now, when I was growing up, I heard this on several occasions, is that, not everybody's going to be a doctor. And, that went in one ear and out the other because I knew I was going to be a doctor. So I want you, each of you, everybody, to repeat after me, I am going to be a doctor. All right. And if you hear anybody say anything contrary, just let that go in one ear and out the other. And also, repeat this after me. I can do all things through Christ who strengthens me. All right. And all things are possible to those who believe. So if you believe in yourself that you can be a doctor, you're going to do it. Now Dr. Webb kind of detailed some of the things you should do now to prepare yourself. And one of the things that helped me, of course, I had family that went through medical school. My older brother went through dental school. And those are all types of things you have access to. If you have access to people like me, Dr. Webb, my wife, just ask them questions. Ask them questions to get familiar with what it takes. And then once you know what it takes, you got your mindset to get prepared for that. So one of the things that I did when I was in college, and we both did, me and my wife, we took electives that helped us in medical school. So one of the courses in college that I remember taking that helped initially really, really well was taking histology. Histology is like looking at our body in the microscope, figuring out what is down to the cellular level, what is going there. So I took that in histology. First year of medical school, we had to take, it's called microanatomy in medical school. So I took histology in college, and I enjoyed it. I liked it. It was learning about the human body. In medical school, everything goes at a faster pace. So everything I learned in histology in college, we finished in probably the first week in medical school. So it goes at a faster pace. But even knowing that stuff that I learned in college, that 1 week helped me adjust to the pace that's in medical school. So I had the highest average in microanatomy in medical school. So knowing ahead of time what to expect and then getting yourself prepared is going to help you be successful. So this is a great program for you guys to be here. What questions can I answer for you before I run on and keep talking? Anything? When I did orthopedics, I did an orthopedic rotation in medical school. That was you asking if did I look into anything else besides? Would I now? Oh, would I now? Would I now look into anything else? No, I wouldn't. Would I have changed anything as far as my specialty? Not particularly. I mean, I love what I'm doing right now. And so if I had to go back and clarify that, I would say, there's a big field of orthopedics. There's a lot of different subspecialties, which, I'm focused on hips and knees, and some people do shoulders and elbows. Other people do foot and ankle. Other people do spine. We had to rotate through all of those, but I chose which one worked for me. Now, when I first finished practice, I went to practice general orthopedics, which is pretty much taking care of everything orthopedic related, even children and older and everything. And I thought that was fun. That was great. I did that for several years. However, I wanted to be an expert in these particular areas of hip and knee because I enjoyed that the most. So it's mainly just about what I enjoyed. But the time frame that I did the general orthopedics was, I would say it was pretty tough because you have to know a lot of things. I know a lot about certain particular areas now, and I know everything about orthopedics, but I don't practice it like surgery. I don't do all the surgeries for the other bones and joints. I do particularly hip and knee surgeries right now. So, when people come to me for a hip or knee problem, 95% of the time I can take care of their problem and issue, and it's not a big thing. But practicing in a wider area where you're trying to do everything, it's kind of hard to keep up with all the developments now because there's a lot of technological advancements in surgery and in medicine. So you do have to kind of focus on what you enjoy the most. Yeah. Yeah.
Is there a pay difference between the people who are in pediatrics with orthopedic surgery, or do they get the same pay as people doing general, or does everybody get paid the same amount, or does it depend on what part you kind of are in?
That's a good question. So the question is, Do pediatric orthopedics and other orthopedics in the same specialty get paid the same? And I would say we all get paid well. We all live a comfortable life. There is the difference is mainly how much you work. So if you have a job now and you work 8 hours a day, but you go to another job and work 8 more hours, then you're going to get paid more because you're working more. And the same thing in medicine is if you're busy and you have a full schedule, you'll get paid more. It's just compensating for you the work you do, and that's it. But everybody gets paid pretty well in that specialty. Yeah. Mm-hmm. Hey.
Have you gotten, my name is Kyler Haley, but have you
Kyler.
gotten the opportunity to work with any of the new biotechnological advancements that they've made through the orthopedic realm?
Like which one?
Like there's certain ones that you don't even use the bone anymore, like they have films that you can use to replace them. Have you gotten a chance to work with any of those?
No. The question is, have I worked with some of the newer biotechnology material that people use to replace bone?
That they're like
Creating bone?
seen the research and stuff, it's pretty cool.
Yes, no, I haven't yet, and those have not become commonplace where they're not widespread. I'm sure that they're used in certain centers. I am in a private practice setting, so what I am exposed to are what the majority of people need. Those areas that you're talking about, I see the research and the things, but I think some of the technology is still not advanced enough to become a common practice in an orthopedic, general orthopedic, or like a regular orthopedic private practice setting. Yeah, it's more probably at what we call a tertiary care center or a university center, where you see those kind of things where you have probably few patients that need those, and then those doctors can help those patients. Yeah. Mm-hmm. Yes, ma'am.
I'm Lauren. I was wondering if there's anything you did throughout high school and just all throughout medical school and college that helped you with standardized tests.
Okay, Lauren asked a good question. If I did anything throughout high school, college, or medical school to help me with standardized tests, and the answer for me is I just practice those tests. So the more you practice it, the better you get at it. If anything you do, the more times you do it, the better you become at it. I know in particular when studying for the medical college admissions test, the MCAT, we had taken a preparation course, a prep course. So we spent 2 or 3 months doing a prep course where we would go back and review all the sciences, even reading in English, because we still had to do some of that for the MCAT. And we had to go back and review all the material that we learned in college, but learn it in a way where we had to answer questions. So it's not a direct question. It's like, what's 1 + 1 = 2? It's more like, hey, what's 1 × 1 × 15 divided by 15? You get the same answer, right? So it's complex like that. So what you do when you practice taking those tests is you learn what questions they're asking, how they ask the questions, and then when you take you look at the answers, you look at all the answers, and you try to correct the wrong answers, make the incorrect answers correct. So you have to correct those statements. Doing that process in the beginning is slow because you taking time to adjust and answer every wrong choice, but you learn a lot. So in the beginning it's slow, but in the end it starts to get faster because your knowledge bank grows and you get more and more. But the answer is the more you do it, the better you're at, the better you are at it. Anybody else has a? Yeah.
I'm wondering
Yeah.
if the other Dr. Walker can join you up there again, and so now we get, if there's any questions, let's take advantage of these 2 doctors right now. Any questions that you want to shoot to both or either one of those? And actually, Dr. Christy Walker, would you answer the same question the way that you did the same question that you had?
So it was for the MCAT prep or how to prepare for the.
Any standardized tests.
Okay, so You have to, just like he said, know your examiner. So if you were studying for a class that you had right now, and your instructor or your teacher told you that the test was going, like your finals, right? The test is going to be just like the finals from the previous years. What would you do? You go find those other tests, wouldn't you? And you would study those, right? Who would do something different? Would you do anything different? You would study those, right? And then you would read on, if the answer choices are from A to E, then you would say, okay, what's the correct answer, right? And then why are these other ones wrong? Why did he try to trick us on this, right? Is this a trick question? Could this be A and E, A plus C, you know? So if you do exactly like he said, instead of reading your textbook from front to back, like in medical school, even in college, like if you gave me something and told me to read from front to back, probably by page 2, I'd be asleep. And so the questions keep me busy, it keeps me doing something, and it helps me to remember. And then I check off my paragraph. You know, so by the time I've finished, I've studied I've covered all the material, but now I know it practically. And I missed it the first 5 times. So you're not gonna get me, I'm not gonna miss it again. So when I take the test, I'm gonna be ready for it, and I'm gonna be ready for the trick. You know your examiner. Well, that's your standardized exams. So I did take a standardized test prep course, and in that course, I was told that for our MCAT, our medical licensing exam, the USMLE test, that our examiner was a 50-year-old Caucasian male from Kansas. Well, I don't know any of those, right? But that's who was testing me. So the patients that I take care of, they don't have the same illnesses or the same thing. So the answers that I would give for this standardized test, if I give that answer how I see and what the patients that I take care of every day, those are going to be wrong. So the best way to do it is to just practice your test. Know the examiner, because it's, you know, yes, A or C could be right, but if D is the answer, you need to know why and how he got there. So practice the questions. So initially you may do 5 questions all day, but by the end, if you're practicing and practicing, you could probably get up, bless you, you could probably get up to doing 100 questions in a day and be prepared to score extremely high on a standardized test. So the students that mentor, that I shadow and work with, that's what I tell them to do. They have to, like, we're not rounding, we're not doing anything until we, we're gonna table this until we do some more practice questions.
So we would do sometimes 100 to, 100 questions in a day, like she said, and we would try to exhaust every potential. Oh, okay. We would do 100 questions in a day, and sometimes if we had access to exam questions or like a question bank, we would try to go through all of those questions. So, but when you do that, the questions sometimes going to be repeating themselves. But the more you answer the same question, the more you know it, the better you are at it. So even when we had old tests in medical school, they would give out the old tests. But the test that they would have this year, or our year, the questions are different. But still, the questions were asking about the same information. So we learned the information by doing it. But some of those tests, we would make only 70% the first time we take the test. So then we would go back and take that same test again. Next time we make 90%. Then we go back and take the same test again until we got 100%, got all the questions right. So doing the same test over and over again still helps you learn. So I would recommend that too. If there's a lot of online resources, get on those and just start taking questions and answering questions. And even if you just read the question, you may not know the answer now, but at some point in your education, you're going to say, hey, that's the answer to that question. At some point in your classwork. Yeah.
Hello, my name is Ms. Johnson. I'm Karen of Caden. Did you guys participate in any type of programs, like in summertime, or do research programs when you were in undergrad that would help strengthen your med school application?
Oh, yes.
Yes, that's a great question. Yes, we did. We participated in, sorry. The question was if we participated in any type of research programs to strengthen our application while we were in undergrad? And so the answer is yes, we did. In college, they had a program, a research program that we were able to participate in. So we were doing like work study, so we replaced work study or, working at McDonald's, Blockbuster with the research program, and we were able to do 20 hours a week there. And then we signed up for a summer, we applied each summer for summer programs, and so we were able to participate in research. One of those places was like NCTR, the National Center for Toxicological Research. So yes, that does help to strengthen the application, because that's one of the things that the medical schools are looking at as far as being well-rounded and what you're doing in advance to prepare for medical school. Yes. I'm sorry. Here.
Oh, so just to add to that, we would try to do something every summer that would help with our application, whether it's a research or a summer enrichment program at a medical school. And even after we finished college and we're accepted to medical school, we went to a pre-matriculation program at that medical school to kind of help us get adjusted to getting ready for medical school and taking classes there.
Oh, and just to say, any pre-enrichment or pre-matriculation program is awesome. If you have an opportunity to do that, do so, because it is just like a day in that life or whatever it is for a medical student, for college, for whatever it is. You're taking the exact same classes usually, the exact same instructors. So if you do that, if you have any opportunity or you see those, look for opportunities like that so that you can take advantage of those. I'll add one more thing that he mentioned about the pre-matriculation program. We were very competitive in school and college and throughout, and usually just like a fraction of a decimal or something different most of the time. But in the pre-matriculation program from medical school, I tried to employ my same the same way I studied in college, and I had I had learned how to cram really well. And medical school taught me that cramming was not going to help. So I tried to cram the pre-matriculation program, and I made my first D ever in medical school during the pre-matriculation program. And Lord, was I thankful that I did it when it did not count. So, and I learned that waiting and trying to, because medical, it's like a moving train. It's not hard. The material to become a doctor is not hard. It's just a lot of it at one time. So you don't get a chance. You can't go and hang out and scroll on social media and, do all of this and say, oh, I'm just going to pull an all-nighter. No, every day you have to study, So, and that's what I learned in pre-matriculation. I learned that lesson then, and I didn't have to worry about that ever again.
All right, as we are closing out, you guys, and oh. Would you mind if the students move? Oh, please.
Okay, just want to get back to the task at hand. For the Doctors Club, just want to let you know that, like I said, we will continue to have what we call rounds, okay? So next month, we're going to have Mr. Eddie Brown from Brown Capital Management spend time with us. He's going to talk to you about how to preserve your scholarship money and how to pay for not only college, but pay for medical school. And the other thing about rounds that we will continue to do is have wonderful doctors from the community that will come in and spend a Saturday with us or telling us about medicine, about science, about math, about chemistry, biology, and helping us pursue our career. So we'll try to set that up for you, and we'll try to do it one weekend per month, and so we can stay on track and stay focused. And we want to have the seniors, as they matriculate through undergrad, stay in touch, and we'll try to do this by Zoom, okay? So have a wonderful time, and hope to see you soon.
That's it. All right, good. Thank you guys for coming. We're all done.